Scenario 1. You've been diagnosed with cancer. After a few months of treatment, your finances are starting to wane. Luckily, you have good health insurance. What recommendations does the American Cancer Society give to people in this situation for paying their medical bills? You can look at the question.
I'm gonna scroll through the website and see if there's anything that I see that immediately jumps out at me about that. I would go as far as to say that treatment and support is probably a good place to start. Finding and paying for treatment, I'm seeing immediately, understanding your diagnosis, treatment and side effects nearing the end of your life. For caregivers and families, more topics, tools to help you navigate treatment, insurance resources. It's immediately right there. You can just keep scrolling until you find it. Immediately there's a button for finding and paying for treatment and understanding what's going on. Different links for health insurance options, managing your health insurance, if you have trouble paying a bill, health insurance laws. I'm going to look for understanding, finding, and paying for treatment. Look at understanding health insurance and undergoing financial and legal matters, choosing your decision. I'm going to go with understanding health insurance and look at health insurance options. Workplace health insurance, avoiding health insurance scams, types of health plans, other health insurance options. If your health insurance is grandfathered or self-funded. I don't really know what might be the best bet for oh, I need to find a way to pay for it. Okay. So if I'm having trouble paying a bill, there's a whole section on that. I'm going to click on it. If you have trouble paying a medical bill, yeah, let's go into this category right here and see what's in here. If you have problems paying a medical bill, there's some information explaining the benefits of different insurance plans. If I have health insurance, it's explaining what I can do to continue getting treatment. If I don't have health insurance, it's explaining. It says, explain the problem to a hospital, clinic, or to the doctor's office or secretary. Work out a payment delay or an extended payment plan. Talk with team social worker about sources of short-term help. Or if I'm having problems with balancing bills, large bills for out-of-network coverage, I can contact my state insurance commission. And I can find out how to reach them in section more information for your American Cancer Society.
That's great. Okay. Scenario 2. You are looking for a program that will help you cut down on your tobacco use. Are you able to find programs in your area that will help with this on the American Cancer Society website?
Sure that I can. So I'm going to navigate back home, and then I'm going to look at this nice top bar here and click on Stay Healthy. And there's a whole category immediately I'm seeing as I scroll down that, oh, it's asking me to sign up. A little bit intrusive there, American Cancer Society. I'm going to go into step away from tobacco and look for sources of local help. Seeing a lot of different, I'm seeing some links for smoke-free communities, seeing some things for keeping kids tobacco-free, and get help quitting tobacco. So the benefits of quitting over time, how to quit tobacco. Why don't we go into how to quit tobacco? And I'm seeing making a plan, getting help with mental part of tobacco addiction, nicotine replacement therapy. Let's click getting help. There are telephone-based programs, it looks like. I'm seeing information about that. Support groups. And I can, right here, it says I can find out if there's an NICA group near me with this phone number, or I can visit their website at nicotineanonymous.org. There's further information about that and what I can expect from the program when I do go.
Okay, great. Scenario 3. You're writing an essay for your health class about cancer-related demographics in the U.S., and you go on the American Cancer Society site to look for information about this. What can you find?
I'm gonna go to their research tab up top and start pouring over what sort of information this is going to bring me. It looks like I can see all of their research news, facts and figures, Cancer Statistics Center. They have a whole website about that. I can click in there and look. I've now been navigated to a website that gives me cancer statistics by state, cancer type, and it looks like there's an analysis tool I can click on. Like, I can choose a metric to sort by, such as incidence rates, mortality, probability of occurrence, cancer screening, cancer risks. Why don't we look at probability of developing cancer from the past few years and see if there's any information about different demographics. Looks like this doesn't have a crazy amount of information in there, unfortunately. Can still explore. Oh, look at this. If we scroll down, it's going to expand out some more information. Look at 2018 estimates for deaths and new cases, as well as state cases, estimated cases and deaths, incident rates by cancer type, incident rates in different states, trends in death rates from different types of and varieties of cancer with a little interactive plot that shows you exact values over time. That's really nice. Trends in death rates for males, different types of cancer, occurrence rates, analysis tool. I'm not really seeing anything that's going to immediately sort the demographic, unless I can, nope. Yeah, I'm not seeing anything that's sorting immediately by demographic, but I'm sure that oh, here we go. Race, ethnicity. Oh, okay. I was missing an entire bar on the side. Well, I can definitely sort by ethnicity. And look at all different types and compare them. Nice little interactive plots. Oh, I can select all the different types at the same time, too. I think that whole interface might be a little bit more obvious if those were all activated from the beginning. It's a little bit misleading that there was only one bar for each paper by default. By default, they should probably all be expanded. That would be nice. No, but there's a lot of categories in here for sure. Oh, and we can combine different ones. That's nice. No, that's interactive. That's cute. Yeah, I do like that.
All right. Scenario 4. Can you navigate back to the home page?
I think I can with one button press.
Yeah.
Yeah. Look at that.
All right. A close friend or family member has been diagnosed with cancer. What does the American Cancer Society suggest about ways you can help?
I'm going to go to treatment and support. I'm going to look for caregivers and family. And I'm going to keep scrolling down on this page. Check out what sort of information this is giving me. How to care for someone with cancer, taking care of yourself as a caregiver. How to be supportive to someone with cancer. With specific articles about different categories like programs and services that the American Cancer Society provides particularly, or what to do when your child has cancer. You can search for programs in my area to look for help handling this. Information Center, patient lodging programs, the road to recovery. Navigate back and check out how to care for someone with cancer. What a cancer caregiver does, family and medical leave. You can research what a cancer caregiver does, and there's different articles about what that means, communication, how you should express yourself, some talking points, what I should know about new medicines. Yeah, I can find that information relatively easily, and there seems to be an abundance of it. Quickly navigate back to this page. Yep. And there's also some information about how to take care of yourself. Yeah.
All right. And the final scenario. You're doing research on why people get liver cancer and the percentage of the patients cured after taking a series of treatment. What reports can you find to support your research?
I'm going to go to our research programs. I'm going to check out the Cancer Statistics Center, and I'm going to try and sort by liver cancer and remission rate, if that's possible. We're going to see. We go to cancer type, liver, and we're going to look through what information this provides. There's different state incidence rates, death rates, probability of dying and developing. You can look at lifetime risk for those who have cancer diagnosis with liver. You can look at 5-year revival rate, which I'm not exactly privy to what the revival rate, relative survival means, but I'm gonna think that that's what I'm wanting. It looks like I can find that information relatively easily and check out the paper that it's published from. Whoop, navigates me to a research page. Looks like I can search for other articles. Just navigated me to the head page, though, not that specific article. Yeah. Relatively easy, though. I'm still unsure if relative survival is what I'm looking for. But if I was researching this, I might know that. That's what I was looking for. I think it is.
All right. Thanks. That was helpful. Do you have any questions for me now that we're done?
I do not. But this has been nice. I will say that I do like their webpage interfaces are all very eye-catching. They're pretty, not just usable.
All right. Thank you so much.